Metformin is one of the most commonly prescribed medicines for people with type 2 diabetes. It has been used safely for many years and is often the first treatment doctors recommend. Metformin helps lower blood sugar levels and improves how the body responds to insulin. Unlike some diabetes medicines, it usually does not cause weight gain or severe low blood sugar. Because of its safety, effectiveness, and low cost, metformin is trusted worldwide. For beginners, metformin is a strong starting medicine for managing diabetes effectively. Type 2 diabetes happens when the body cannot use insulin properly or does not make enough of it. Insulin helps move sugar from the blood into the cells for energy. When insulin does not work well, sugar builds up in the blood. Metformin helps by improving insulin sensitivity, which means the body uses insulin more efficiently. Instead of forcing the pancreas to produce more insulin, metformin works gently with the body's natural system to control blood sugar levels. One major way metformin works is by reducing glucose production in the liver. The liver releases sugar into the blood, especially when a person is not eating. In diabetes, the liver often releases too much sugar. Metformin slows this process, helping lower fasting and overall blood sugar levels. This action is very important because excess liver glucose is a major cause of high blood sugar in people with type 2 diabetes. Metformin also helps muscles and fat cells absorb more glucose from the blood. When insulin sensitivity improves, cells take in sugar more easily and use it for energy. This lowers blood sugar levels and helps reduce diabetes symptoms. Better glucose use by cells also improves energy levels. For beginners, this means metformin helps the body function more normally without causing sudden or extreme changes in blood sugar. A key advantage of metformin is that it does not usually cause hypoglycemia or dangerously low blood sugar when used alone. This makes it safer than many other diabetes medications. Because it does not directly increase insulin release, metformin lowers blood sugar slowly and steadily. This is especially helpful for beginners who are still learning how to manage diabetes safely and confidently. Metformin is taken orally as a tablet. It comes in immediate release and extended release forms. Immediate release tablets are usually taken 2 or 3 times a day, while extended release tablets are taken once daily. Doctors often start with a low dose and increase it gradually. Taking metformin with meals helps reduce stomach side effects and improves tolerance, especially during the first few weeks. Some people experience side effects when starting metformin. Common side effects include nausea, diarrhea, stomach upset, gas, and loss of appetite. These effects usually happen at the beginning of treatment and improve with time. Using extended-release metformin and taking the medicine with food can reduce these problems. Most people tolerate metformin well after their body adjusts. A very rare but serious side effect of metformin is lactic acidosis. This condition happens when lactic acid builds up in the blood. The risk is extremely low but higher in people with severe kidney, liver, or heart disease. That is why doctors check kidney function before and during treatment. When used correctly under medical supervision, metformin is considered very safe. Metformin is also used for other medical conditions besides diabetes. It is commonly prescribed for polycystic ovary syndrome, or POS, to improve insulin resistance and regulate menstrual cycles. Some doctors also use metformin to delay or prevent diabetes in people with prediabetes. These uses show how metformin affects metabolism and insulin sensitivity beyond just blood sugar control. Unlike many diabetes medicines, metformin usually does not cause weight gain and may even support mild weight loss. It can reduce appetite slightly and improve how the body processes sugar. This makes it a good option for patients who are overweight. However, metformin is not a weight loss drug and works best when combined with a healthy diet and regular physical activity. Metformin also offers benefits for heart health. People with diabetes have a higher risk of heart disease. Studies suggest that metformin may reduce cardiovascular risk by improving blood sugar control and reducing inflammation. Because of these benefits, doctors often continue metformin even when adding other diabetes medications to the treatment plan. Taking metformin regularly is very important. Missing doses can reduce its effectiveness and cause blood sugar fluctuations. Beginners should take metformin at the same time every day. If a dose is missed, it should not be doubled unless advised by a doctor. Building a routine helps achieve stable blood sugar control and better long-term results. Lifestyle changes greatly improve how well metformin works. Healthy eating, regular exercise, and weight management are essential parts of diabetes care. Metformin supports these habits, but cannot replace them. Even small lifestyle changes can make a big difference when combined with medication. Beginners should see metformin as a support tool, not a complete solution. Regular blood sugar monitoring is important while using metformin. Testing helps show how well the medicine is working. Doctors may also check HbA1c levels to measure long-term blood sugar control. These results help guide treatment decisions and dose adjustments. Monitoring helps beginners stay informed and confident in managing their condition. In summary, metformin is a safe, effective, and beginner-friendly medication for managing type 2 diabetes. It lowers blood sugar by reducing liver glucose production and improving insulin sensitivity. With proper use, healthy lifestyle habits, and medical guidance, metformin helps millions of people control diabetes and live healthier lives. Understanding how metformin works allows beginners to take an active role in their treatment and long-term health. Follow MD Pharma for more.